tonight's a good night because um, there's a lot of questions you guys have posed in the group, and I always like answering questions because for me, the more information you have, the better you can solve your problems. And so we're going to get into that in just a few minutes, just a moment. I am going to see that everyone, okay, so make sure that you can see me and hear me okay. I think we're good. We've had some trouble in the past with our feed, and it was a little different connecting tonight. So I just wanted to make sure that we are connected. Really good. So before I get into the Q&A, I will go ahead and say my disclaimer. And so everything that you hear tonight during this Wellness Wednesday is intended to be health information and not health advice. Now, I know some of you have asked questions, and some of them are of a personal nature. Please understand that I don't have all the information that I would need to, really fully answer some of your questions. So keep that in mind. Don't stop taking, change the way you're taking any of your medications. If you feel like you need to do that, please first consult with your prescribing practitioner to let them help you do that safely. And by attending this Wellness Wednesday, especially this Q&A, this does not establish a doctor-patient relationship. So also super excited before I get into the Q&A, super excited to remind you about the masterclass. It's coming up in just over a week's time. So about a week and a half, right? And so excited to share the information that I have to impart to you because, and I go into great detail. Some of you have asked some really, a lot of these questions are great, but some of you have asked some questions that certainly will be answered so well in the content of the masterclass. This is who this is for, all right? This masterclass is for anyone with hypothyroidism, anyone with hyperthyroidism, anyone who doesn't have their thyroid, anyone who has trouble losing weight, and even those of you who have trouble gaining weight. So if weight isn't an issue and you're still having symptoms, you're still having the fatigue and brain fog, depression, anxiety, whatever the symptom is that certainly can be related to hypothyroidism or thyroid dysfunction, this is for you. So it doesn't matter if you maybe you don't even know if you have a thyroid problem. You just know something's wrong. All right. You know that you're having symptoms and you haven't been able to get to the bottom of it. You haven't been able to get your doctors to listen to you. That's who this is for. You're going to learn about insulin resistance and blood sugar issues. If you even have any clues that you have a metabolic or metabolism issue, then this class is for you, okay? So let's get into your questions, but please mark that on your calendars, the 9th through the 13th. You don't want to miss it. Like I told you, who this is for. If you're tired of your symptoms, if you're tired of not having answers to your symptoms, whatever the symptom might be, headaches, joint pains, irritability, mood swings. If you think, well, what if, Dr. Redd, what if it's just menopause? Well, is that normal? Is it truly normal to have these menopause-related symptoms? And are you tired of them? I mean, or do you think you should be way past them by now? Those of you who maybe in your you know, in your late your 60s, your 70s, 80s. Shouldn't you be past these symptoms? What if you're still having them? Is that normal? Okay. So this is for you. Yeah. Now, like I said, mark it on your calendars. Be prepared to spend every night that week, okay, for an hour, hour and a half, attending these sessions live. You'll get the most out of it if you attend live. And come prepared to learn. Bring your notebooks. You will have a workbook that will be ready to download and print. Yeah, it's going to be awesome. You'll gain so much information. Now, one of you asked, and I'm going to answer this question right now. Dr. Redd, what do we do with the information you share with us, right? What do we do with that? Make sure that's the whole question. And then do you discuss diets? Okay. Well, yes. But let me first let me answer the first part of that question. What do you do with this information? Well, if you truly want to solve your problems and you receive information that is going to help you to solve these problems, isn't it important to act on it, right? And in the masterclass, I will tell you exactly what you need to do to act on this information. And for that reason alone, you don't want to miss it, right? For that reason, you will want to know, you'll want to attend and know what to do, actionable steps, right? To feeling better, all right? And so as far as diets, yeah, I discuss diets, but understand that that is a very individualized answer too. And it needs to be addressed with you on an individual basis. Now, I'll give you some general things. I will talk a lot about this in the class, and I will give you general guidelines. General, okay? But that doesn't mean that that's all that needs to happen with your diet, all right? And many of you have learned over and over again from your doctors that you just need to eat right and exercise more. And it just isn't enough. That advice sucks. I'm sorry. It's not enough. And it has to be individualized to you, customized to what's going on with you. And I'm going to show and share with you what that is, how to get that information for you. All right. So let's dive in to more questions. The first one, Carolyn asks, what can you do to get rid of high cortisol? Well, let's understand what cortisol is first. For a lot of you new ladies or ladies that don't know what that is. Cortisol is the stress hormone produced by the adrenal glands and when you're under stress. And that stress can be either physical stress, so being heavy, right? Exercising too much, having had maybe surgeries or some type of injury, an accident, physical stress, right? It can be emotional or mental stress, right? Don't know that I need to enlarge on that too much. Or it can be chemical stress, chemicals from the environment that you breathe in, that you drink in the water, that you eat in your food. All right, foods are stressful. Okay, food is toxic. Certain foods, right? And we discussed this in great detail in the masterclass. So how do you get rid of high cortisol and what does it do? What does cortisol do? Cortisol causes blood sugars to rise. Cortisol, it helps prepare your body for fight or flight, right? So it raises your blood sugar. It helps you manage It is an antioxidant, so it helps manage some of that, but not too much. If you have too much, it's not good. It will cause weight gain, right? It'll cause cognitive issues, so it can interfere with memory and focus and sleep. It'll certainly, high cortisol will interfere with sleep. And so this is a great question, like, how do we lower it? Well, there are many lifestyle changes that if you will make can help you lower cortisol. Excuse me, swallow wrong. And there are certain supplements. There are supplements that help lower cortisol, but we really need to see with the right tests, if it is indeed high, and if it is for sure high, then we, use that information as part of a customized treatment plan to help you lower it. So like I said, there are lifestyle changes, and those include some, mindfulness practices, relaxation techniques, breathing exercises for sure, included in some of those relaxation techniques. And then, yes, there are certain supplements. Certainly getting rid of the stressors as much as possible, right? That's why I mentioned the stressors. So try to minimize physical stress, minimize emotional or mental stress as much as possible. Get rid of watching the news, guys. So much stress comes from just watching the news. And I mean, I don't mean to put your head in the sand and don't worry about what's going on, but some of you are literally obsessed with watching the news and reading it. So, and then try to decrease the chemical stressors in your life. Okay, next question. Jessica asks, how could you ever figure out what the problem is if you don't have Hashimoto's, but you do have hypothyroidism? Okay, well, that's a great question. There are root causes for hypothyroidism. Hashimoto's just tends to be the most common one. And you may have been told that you don't have it, but you might, all right, because of the way doctors interpret these tests. So the first thing is, well, let's get the right tests and see if you actually do have it. Let's interpret it the correct way and look at all the evidence to support whether you have it or not, right? Then if you don't have it, let's look at all the other possible root causes, and there are many. Your thyroid is it's susceptible. It's very vulnerable to infections and toxins and stress, and it really takes just getting to the bottom of it with the right tests, right? Okay, next question. Sharon asks, what are your thoughts on NP thyroid medicine? I'm not, I'm not sure what your goal on this is, but NP thyroid is just one of the many types of thyroid replacement hormones that exist out there. It's one of the natural porcine sourced thyroid hormone replacements, and it has T4 and T3, and I think for some people it's fine. It should work well, but I know sometimes it doesn't. And this does not necessarily mean that it's the wrong medicine for you, for your thyroid, condition, but it's generally a pretty decent medication. Now, the one downside to it is that it is made with certain fillers, being a little tablet. It's going to be made with some, I believe it's like a cornstarch based or corn-based filler. And who knows where that comes from? It's probably not organic corn. And some of these tablets too are made with, with other things like lactose, with with wheat-based fillers and binders. So you have to keep that in mind sometimes when you're trying to really clean up what you're putting in your system. Okay. All right. Mary asks, how does mold toxicity affect your thyroid? I'm going to also couple that with this question from Rachel, who asks, how can you help cleanse your body from mold? What do you know about vertigo and its side effect from mold toxicity or other issue? Okay, so mold toxicity certainly can affect your thyroid because mold toxins, especially if you are susceptible to mold genetically, and I, again, dive much deeper into this during the masterclass, but mold toxicity can cause any organs to be dysfunctional, but the thyroid, certainly it can cause it to be less functional. It can be a cause of Hashimoto's. Mold toxicity can cause Hashimoto's as well, which will lead to thyroid problems. So that's how mold is involved there. And you can cleanse your body from mold. It takes a specific, fairly involved detox process, all right, to prepare your liver to take, to aid your body in getting rid of these toxins, and kidneys. So you've got to support those, those important detox organs and open the detox pathways so that you can efficiently detox your body from mold toxins. And if you're susceptible, you've accumulated these mold toxins over your lifetime. And if you can't get rid of the mold toxins on your own because of your genetics, then you definitely need to have help to get rid of this. Yes, vertigo can be a side effect or a symptom of mold toxicity. There are a lot of cognitive and brain neurological symptoms that can be related to mold toxicity as well, including Alzheimer's disease and dementia. So it is really important that we take care of the mold issue. Okay, next question. Mary asks, how does Dr. Redd test and treat hormone issues such as low estrogen or low testosterone? I test hormones in saliva. That's going to be the most accurate way to test them. Saliva, it's like the difference between that and blood. And I'll be honest with you, you don't learn this in medical school, okay? This is over the top, okay, than what you learn in medical school. Hormones are in fairly low concentration, lower percentages in the blood, okay? They really tend to end up in the tissues more than anything. And saliva is a tissue test, okay? So the analogy I always give is it's kind of the difference between, being a player, on the basketball court versus a spectator in the crowd watching the game. Testing in the saliva is more like being on the court with the players, maybe closer to the sideline so you can really see what's going on in the game. Whereas the blood is kind of like, well, being a spectator in the crowd, just kind of seeing some things. Okay. So that's the biggest reason why I test in saliva, test the hormones in saliva. And then really it's just about taking care of the upstream issues first, because, the downstream hormones are affected by everything upstream that's happening. And if you're not balancing things upstream, then you're certainly not going to balance the hormones downstream. All right. And you can do damage by just replacing hormones too quickly, because excess hormones can have ill effects on thyroid function. Okay. It can affect autoimmunity as well. And I, again, go over this in much more detail in the class, in the master class. Next question. Ladies, this is going okay, right? Thumbs up if this is going okay. Why doctors say that we do not have to change our eating habits if we have Hashimoto's hypothyroidism. All I can say to this is they don't know what they don't know. If they're telling you, if your doctor, endocrinologist is telling you, you don't need to make dietary changes, they simply don't know what they don't know. I'm sorry, but you do have to make changes, major changes in most cases when you have autoimmunity. There's no other way around it. And I'm sorry that they're telling you this. They're not telling you everything that you need to know. All right. It never ceases to amaze me, but that's the truth. There must be changes that you make to your diet when you have Hashimoto's or any autoimmune disease, really. Angela asks, when are we done detoxing? Do we know by lab tests, or how long does it usually take on average? Can it be months? A proper detox can take months, especially when it comes to mold or parasites. Heavy metal detox can take at least a couple months. Okay, so it does take time. There are certain tests that can be done, especially in the case of mold toxicity. And usually the biggest indicator that you're done detoxing is that you feel better. And, I just talked with a lady today. She was finishing up her care program, and she noted to me, I didn't even ask her, that she realized she was done with mold detox when she finally started to feel notably better. Okay. And I thought that was very interesting. It's exactly what, I try to tell people, like, we do have to pay attention to your symptoms. Your symptoms are your body's way of telling you something's still off, right? So that is, it's okay to go off your symptoms, especially if you notice something like that drastic. One of the gals that I've had as a patient, she worked at home and she was, going through mold detox, and she had to have her home treated. And we explain, if you become a patient, we explain how to do that. And she mentioned that she felt a notable difference after she had gone through the detox for a few months and after her house had been adequately treated. And it was like night and day for her. She said somehow the brain fog just left. It was almost like overnight. And I know it may not happen overnight, but when your body gets rid of these toxins, you kind of breathe a sigh of relief, and it just starts doing better. You start feeling better. Okay. Kim asks, can this be fixed without, paying a lot of money? All right. As you probably know, tests cost, right? There's a cost to these tests. Insurance doesn't cover a lot of these tests. Supplements, high quality supplements. A lot of you who have researched this and who have really dug into this and tried, you've ordered supplements, you've ordered, you've attended like a, webinar or some sort of presentation, and at the end there's always a supplement. Ladies, I'm not going to be selling you any supplements with this masterclass. I'm not going to do that. That's not my purpose. I'm going to give you information that you need. to put into, to put to work or not, right? It's your choice. Anyway, I mean, yeah, and working with someone who knows what they're doing, there's always going to be a cost to it. So should you prepare? Yeah, I mean, I think you should prepare for some costs, right? I think that's just common sense. You can't get something for nothing. And especially when, there's something so valuable as getting your health back, getting your life back. So I think it's a fair question, right? So understand that, yeah, there are costs, but if you know what you need to do, just like with anything else, you'll be prepared to meet that. All right. All right. Shannon asks, can cortisol levels be raised naturally? Okay, so the opposite of the first question. Can I, if I can get off hydrocortisone? Okay, so cortisol is different than hydrocortisone, first of all. Hydrocortisone is used to help balance your fluids and electrolytes. And when you don't have a pituitary gland to help your adrenals make those hormones, to signal the adrenals to make those hormones, you may not, that may be something you need to take for the rest of your life, because you're not going to get the signal to make it. Cortisol, on the other hand, can be low simply because the adrenals are tired. Maybe they're malnourished. Maybe they're not getting the thyroid function that they need. Maybe they're not getting the sugar that they need to function properly. So it's important to nourish the adrenals, to make sure that the thyroid is balanced, to improve cortisol if it's low. I mean, yeah, I mean, it needs to be balanced. And then there are certain supplements that, adaptogens that help raise cortisol levels. A lot of you have heard of ashwagandha. A lot of you have heard of rhodiola. A lot of you may have heard of Shisandra. All different adaptogens. And you don't always know which one you need, which one you will react the best to, which will help the most until you try them. But they do need to be the highest quality that you can get. Otherwise, you just don't know what you're getting. All right. This is a little longer question. Anita asks, so I have hypothyroidism and a nodule on my thyroid, and I've been on levothyroxine since 2014. I've also had fibroids in the uterus and breast, and I'm iron and vitamin D deficient. I've done research, and I'm pretty sure I'm blocked. So I'm thinking you mean constipated. I'm not sure exactly, Anita, what you meant by that. My eating habits don't exist because I actually only eat one small meal every day or so. I have no appetite. I do take a multivitamin, D3, iron, vitamin E, women's probiotic. I do drink coffee, water, tea, juice, milk, not all of them always. So my question is, how do I unblock my system? How do I get an appetite? How do I get rid of the nodule? How do I get my thyroid? How do I get my thyroid to work? Okay, so I know this is a very personal question. Thank you for sharing this. And I will say, there are multiple things going on that are imbalanced. Okay, there is only one way, in a nutshell, to unblock yourself, to get your thyroid to work, to increase your appetite, because your stomach acid's probably low if you don't have an appetite. You have these nodules probably, and I'm not saying for sure, but you will need to be tested, probably have Hashimoto's. And if that's the case, there's all sorts of triggers that you need to find. Bottom line, to answer your questions, you've got to get comprehensive testing. And I talk all about that in the master class. I go through that in great detail. I show you what I'm going to be testing for. I show you how I go over it. I'm going to spend, a full session going over, how I go through the labs, how I go through these tests with you to show you what's actually going on. It's awesome. You will know exactly what you need to know. Okay. So it's not like I said, that's the best I can answer your question in this forum, in this public forum, but attend the class, find out how to get the testing you need, because I will talk about it, and you'll be on your way to really finding those answers. Okay. All right. Debbie asks, several years ago, I was told my blood work showed elevated levels in areas that were indicative of systemic lupus, erythematosus, but my thyroid levels were fine. 3 years ago, that changed, and I was diagnosed with hypothyroidism and put on levothyroxine. Now they are saying that levels no longer indicate lupus, but they have increased my dose of levothyroxine twice, and my symptoms seem to be getting worse. I know they are both autoimmune disorders, so they're not. Hypothyroidism isn't necessarily autoimmune. Okay, it can be. It likely is, but it's not necessarily. Is there something that they are missing or treating one when it's the other, or is it both, or what? How can I find out what's really wrong? Because I feel like my body is destroying itself, and migraines and brain fog coupled with residual issues from TBI leave me so lost and confused some days. I need help. And I'm sorry, that was Sammy. That was Sammy's question. So Sammy, you do need help. And I would, this is a recurring theme. You will need to get the right testing to find out, if you do have Hashimoto's. And I'll tell you, once you're diagnosed with an autoimmune disorder, it doesn't just go away. So if you were diagnosed with lupus because you had markers in the blood showing you had them, it really isn't unusual for later blood tests to show things that are normal, but it just kind of depends on like the level. They'll see like a mild positivity and say it's normal versus a more not more severe level, higher level in your blood, so to speak. And it's just like with Hashimoto's. If you have the markers for it at all, you have it. It's the same with lupus. If you have the markers for it at all, you have it. It just depends on how it's affecting your body. And autoimmunity, and I've done a Wellness Wednesday on this, is when your immune system attacks your body. Different tissues get attacked. And so it certainly can be both, like you're asking. If they're only treating the thyroid issue, then it's not going to affect the lupus, right? There's other things that must be done. And I, again, go over these in great detail in the class, but you have to find your triggers. So, and if it is indeed Hashimoto's thyroiditis, then treating with levothyroxine isn't the treatment for Hashimoto's. It's the treatment for hypothyroidism, but it's not the treatment for Hashimoto's. So you're right, you very well may not be getting the right treatment at all. So you find out by getting the right tests. That is important. It's vital. Okay, then you'll have the information you need. Okay. Debbie asked, okay, this is Debbie's question. Why does the surgeon who took out my goiter, big goiter, only check for T3 levels, and another doctor checks T4 and whatever free one? Okay. So why do these doctors just kind of pick and choose what they test, is your question? Because they don't know what they don't know. The problem is There are multiple markers for your checking thyroid, and I go over all of those in great detail in the class. So you have to check multiple markers. They're not getting the full picture. So the simple answer is they don't know what they don't know. And so if they're only going to test one thing, then that's all they think they need to know. But that's not going to get them the right answers. Okay. Okay, Nicole asks, any suggestions to remedy 50% hair loss? What is the root cause? I love this. No pun intended. That was funny. So Nicole, hair loss has multiple causes. That's a lot of hair loss. It is. And there are autoimmune diseases that diseases that can cause hair loss. Just talked with a lady recently who has a skin condition called lichen planus. That can cause hair loss, the scalp. Psoriasis, that can cause hair loss. These are autoimmune conditions. You can have low thyroid. You can have insulin issues. You can have, so metabolic issues will sometimes lead to hair loss. Your hair is your body's last priority. Okay. I know it's one of your first priorities because for you ladies, your hair is like your crown. It's like, it's all that for you. And simply put, your body's last priority is your hair. Okay. So sorry about that, but there are ways to fix it. And we just need to find out by getting the right test to see what you're dealing with. Okay. Next question. Cheryl asks, I am on NP thyroid and liothyronine, but still don't feel great. My energy level is nil and I fall asleep if I sit down too long. I have chronic low white blood cells. I have dealt with breast cancer twice, have had long COVID for 2 years. Well, your immune system is doing, it's definitely dealing with a lot, your immune system, okay? It's so possible, probable even, that you have Hashimoto's, but you would need to be tested. You're not feeling great because the root causes for this issue have not been found, right? Just treating with the medicine, with the thyroid replacement hormone, isn't always going to do it. When you have other imbalances that are contributing to your thyroid issue, you've got to find out what those are and help those, okay? It's all about getting to the root cause. Okay. There was more to Cheryl's question here. And like I said, I actually want to go through the rest of these. She also said, had my raw DNA analyzed and learned I have both MTHFR variants. You've heard of that, right? Maybe. And I have horrible gut issues, which feel like a root cause to everything. My gallbladder was removed in 2005. I feel like my liver is struggling to do its job. It is, probably. And without the gallbladder, you don't digest fats. And so you'll have trouble with having enough cholesterol, perhaps, or this can affect your hormone levels. And she says, I want to feel well again. I have many food sensitivities, so I struggle to know what to eat. Is there hope for me? Of course, there's hope for you, Cheryl. Again, just finding out what is going on, truly going on with you, is vital. Okay. Marion asks, how long before you can feel better? I've been on thyroid meds since 95 and still feel like walking around in lead boots. So, Marion, it's true. I mean, like I said, taking thyroid medication, even if you're diagnosed with hypothyroidism, isn't the answer. It's a Band-Aid at best. And if it sticks, it sticks. If it doesn't, there's other things that are going on. So you've got to find your root causes. Okay. Comprehensive testing is the only way that you can start to feel better. And then after you find that out, it may not take super long, maybe just a few months before you start feeling better. But the key is finding out what is actually going on. Okay, Maria asks, all my lab work is perfect. Nearly everything you can test for has been tested and is normal. may doubt that a little bit, that you've had everything tested. But I still have several symptoms that align with thyroid issues. What are we missing? Maria, you're missing someone who actually knows what these lab tests mean. You are missing getting actually all the thyroid labs tested that need to be tested. You're missing someone who can actually go through this with you, look at this from a functional medicine perspective, and not just, looking for normals or abnormals. Okay. Because you'll find it. I know you will. If you didn't, I would be shocked. Okay. Attend the masterclass. Find out what I'm talking about. Find more out about really what the tests mean, because I described that in detail. So you really should attend the class and attend all the sessions, because from the beginning to the end, I discuss everything you're asking about and everything you need to know. Rachel, oops, I already asked hers. Becky asks, how do I correct my Hashimoto's antibodies? You don't. The goal really isn't ever to correct the antibodies. They're always going to be there to some extent. They may reduce quite a bit, or they may not. They may increase while you get better. It really doesn't correlate with how well you're doing, okay? Or how many antibodies you have, all right? So you could be doing very well and have a lot of antibodies, okay? I'm getting close to the time tonight. I have a few more questions, but I'm going to just cover a couple more, and then I'm going to mark the ones I didn't answer, and I'm going to include them in my Q&A for the masterclass. All right. I'm going to, keep these handy so that when I do the Q&A, we're going to get these answered. And I bet that by attending the masterclass, those questions that I didn't get to tonight, you're going to have answers. Okay. Try me, attend the class, see if you don't get the answers you need and want for your questions. Okay. So Katie says, or asks, hello, I'm new. Hi, Katie. Thanks for sharing more information. I get very confused with all the info out there. I have an arthritis autoimmune disorder and suspect I have more than one issue, but always seem to have regular, normal thyroid labs, but can visibly see that it is enlarged in my neck and can even see nodules. My doctors don't seem concerned, but even my friends pointed out. Should I ask for an ultrasound or something? I do have many symptoms, but I'm also perimenopausal. Thank you in advance. Okay, so I know this is kind of a particular issue or specific, but I wanted to read this one because while I will explain, like I said, about the labs during the master class, the question about getting an ultrasound is important. If you can see swelling, and if you can see nodules, I think it is absolutely worth getting a test, getting a scan, because if it is Hashimoto's, you are at risk for thyroid cancer, right? So you might want to get that ultrasounded. I'm sorry that your doctor doesn't seem concerned about it. I would definitely say go through, maybe get another doctor. I don't know, but find a doctor who will order a thyroid ultrasound for you, okay? And get that checked out, okay? And then attend the class and see what other information you're missing, because even if your labs are normal, if you really look at them closely and dig deeper into the normal ranges, we will find the dysfunction most of the time, all right? We have to look at these differently, realizing that there are functional, optimal ranges, even within the normal ranges, okay? Okay, and the last question that I'll address, okay. It's hard to decide. Okay, I'm going to ask this one or answer this one. And I assume that this is referring to Hashimoto's. My daughter and granddaughter have it. I take thyroid medication. Is it possible for me to have it as well? And yes, because Hashimoto's is one of the most important and most common causes of hypothyroidism for why you take the medicine, you need to know what that is. You need to test for it. You need to get comprehensive testing to find all the answers that you need. And so, yes, it is absolutely possible. I'm sorry, I lied. I'm going to do one more question. Barbara says, oh, and that was Robbie asked that about possible Hashimoto's. Barbara asks, I'm sorry, Deborah asks, my doctor told me that nothing is, well, see, there's a couple of things here. She asked two questions, and I want to ask the right one. Anyone with Hashimoto's or Graves dealing with pretibial myxedema? For me, I can deal with most of the other symptoms okay, but this can be absolutely debilitating and probably the most painful experience I've ever had to live with. Would love a way to see it go into remission, but have not found one doctor who knows much about this rare condition. I do about anything to get it under control. Okay, so Deborah, and you also asked about, some question. You asked about your thyroid and your doctor had told you nothing was wrong with your thyroid. Okay, well, I'm sorry that they said nothing was wrong with your thyroid. Remember what I said, that even though your thyroid labs might be normal and you can have symptoms and you can still have thyroid issues, then the labs do not have to be normal or do not have to be abnormal because with Hashimoto's, that can screw up how your labs look. Okay, so if you have Hashimoto's and you've got to be tested for this, then your labs, it may make your labs look normal and they'll miss it totally. And you'll continue having the symptoms. And this painful pretibial myxedema, which is the most common reason for this is hypothyroidism. But if you have Hashimoto's that's causing that, and it's making your numbers look normal, then it's going to be missed. And your doctor's got no idea what's going on cause the symptoms you're having that are so painful. So get the right information, and you can do that. I promise. You can get the right testing. You can get the right information from the testing to show what's really going on with you. So please attend the class, Deborah. Please attend. Know that you'll find answers. Have hope, because there is hope. And all of you ladies here tonight, as I wrap up tonight, and like I said, I promise I will get to your questions during the Q&A during the masterclass. There is hope. Once you know what's truly going on with you, there's something you can do for it. We can help you know what to do for it. We can give you the steps and the things you need to do. And then if you just do them, you can find relief. You can get your energy back, stop being depressed, stop being anxious. You can get rid of the brain fog. More importantly, for many of you, you can shed the weight. You can reshape your bodies, right? For some of you who need to gain weight, that's possible too, all right? Thanks for sharing this Wellness Wednesday with me tonight. I really look forward to connecting with all of you during the masterclass. Tune in next week as well for Wellness Wednesday, though. I'm not sure of the topic yet, but it'll be good. And remember, have hope. And remember that you still have the power to heal. Take care, everyone, and have a good evening.